So the rotator cuff tendons are located on the shoulder. There's 4 main tendons. There's supraspinatus, subscapularis, infraspinatus, and teres minor. And these tendons all work together to ensure that you have good stability around the shoulder. The main tendon that gets injured, or the most common that's injured, is the supraspinatus. And then it's subscapularis, and then it's infraspinatus. It's very rare to see an injury to teres minor. Now, the signs and symptoms of a rotator cuff tear do vary, and it's going to depend on whether you've done that acute tear or whether it's that more degenerative tear that comes on gradually. But most people complain of pain around the shoulder. Sometimes it's at the front, sometimes at the side, and it can even be at the back, or it can be all those positions. And a lot of the time, people actually get pain referring down the arm. So although they've got a problem in the shoulder, actually they feel more of the pain on the outside of the arm. And it can even go further down the arm into the hand. A lot of people have problems sleeping on that shoulder, and also it can just wake them up at night, and they can have difficulty either getting to sleep, or they may wake up at 3 or 4 o'clock in the morning in pain. Now, most people that have a rotator cuff tear do have problems bringing their arm out to the side. Some people with a rotator cuff tear can go up quite high, and some people are very limited. And if you resist the arm there, like we would do in clinic, often that causes and reproduces the pain. Now, it's important to remember that a rotator cuff tear can actually present and mimic other shoulder conditions, such as shoulder calcification, or a rotator cuff tendinopathy, or a bursitis, or even a frozen shoulder. The treatment of rotator cuff tears depends on the exact type of tear, and also your levels of pain and what function you need to get back to. Most rotator cuff tears get better with physiotherapy alone, once you've got that initial diagnosis. Physiotherapy is going to involve hands-on treatment, but also rehabilitation to restore the normal movement of the joint and the normal strength. It's really important to remember that rotator cuff tendons do take time to get better. It often takes 6 to 12 weeks to actually improve your pain significantly and get you back to full function. If things are not improving with physiotherapy alone, then here at Complete we do have other options available. We carry out ultrasound-guided injections to try and improve the healing of the tear, and also to help settle down the pain. On very few occasions, rotator cuff tears don't get better, and we can always refer you to a surgical colleague who can have a look at it and see whether this is appropriate for surgery.